Hello, my name is Beth Cogswell. Welcome to Working for You. This program features employees who work for the Missoula City or County, and I talk to them about the work that they do. Today, my guest is Pam Goldberg from the Missoula City Health Department. Pam, do you want to tell us what your title is at the Health Department?
Yes, I'm Pam Goldberg, and I am a registered nurse. I'm a certified public health nurse, and I am the infectious disease intervention specialist for the Missoula City County Health Department.
Before we went on the air, you said that you deal with about 30 different infectious diseases.
I do.
And I won't make you name those. But why don't you talk about what a normal day is like for you? And I know that you do some testing at your office. And
that'd be perfect.
So.
I usually show up at 8 o'clock, and my phone is full of messages. So the first thing I do is sit down and I take all the messages off the phone and return those. And it's usually questions on STIs and infections and everything from bats to I ate at this restaurant and I think I'm sick, to my child has a rash. What do I need to? Should I keep them home from daycare? Should I send them? Just to everything. I have teenagers calling with questions. I have grandparents calling with different questions concerning grandchildren. And so some of my calls, I enjoy that part. I enjoy talking with people. And then on Mondays, I do HIV and Hep C counseling and testing. And I usually have them scheduled. And I communicate with the receptionist upstairs at the health department. So I will go up, and I usually take about 30 minutes per client. And a typical a person wanting an HIV test, I'll bring them back and I'll first discuss the test options because I can draw blood from the vein, send it to the state. Or we have this wonderful 20-minute finger stick that I absolutely love. And so usually they want the finger stick. So I discuss the pros and cons of all the testing, and then I go over if this is negative, it's 99.6% accurate. You can count on it as long as you're through your window period, which is 3 months. And then if it does show a positive, what that can mean, conditions like even lupus can cause that to be positive. So it doesn't mean that you have HIV. If I do have a preliminary positive is what we call it, I will then draw blood, send it to the state for a Western blot. So we do confirm there. But I love it. I take 20 minutes, and I'm able to sit one-on-one with clients and answer all their questions. And usually people come in very nervous and just really scared of what they may be coming into. But then usually I'm able to calm them down, and they leave very happy, especially when they get the results that they desire. And so it's a great experience for people and for myself because I really love HIV testing. And Hep C is the same. I do the education. That's not a quick test. It is a blood draw, and it takes a week and a half for the results to come back. But it gives me the chance to educate people and let them know these are the risk factors and this is how you will not get it, and so it's great.
And is hepatitis C similar to HIV in that it's a sexually transmitted infection only, or are there other ways to get?
Hepatitis C is a bloodborne infection. Hepatitis B is sexually transmitted. When I start talking to folks, I say, okay, A, B, C. A, think food. B, think sexually transmitted. C, blood. There's less than a 1% chance that you will get hepatitis C by having sex with somebody. What I see a lot of is from methamphetamine use from sharing needles. That's the majority of the cases that when people are positive, sharing needles. And tattoos and...
Now, have you seen an increase in the number of hepatitis C?
I have.
Positive people?
Yeah.
And probably because of meth use?
It is. It's because of meth use. And also, hepatitis C was always known as non-A, non-B years ago. And we really didn't keep track of it. But a few years ago, they called it Hep C. And then 2 years ago, when I started this job, the state said, okay, we need to start keeping track of it. So then I started keeping numbers, and yeah, I'm amazed. We have a lot of Hep C here. I'm already at about 200 cases, and this is only July for Missoula. Now, a lot of these cases, people think back and they remember, oh yeah, when I was 18, I did do that. Or Vietnam, they were in the Vietnam War. So a lot of times these are people that have actually had it for a long time, and they may have known about it, but they just want to get checked again, or either they think back and it's like, oh yeah, that's when I was exposed.
And is there a cure for hepatitis C?
There's not a cure for hepatitis C.
So it can be asymptomatic for years, and then what happens when people do start showing symptoms?
It's the symptoms of hepatitis, which infects the liver. You'll have nausea, vomiting, lethargy, everything to jaundice, just a whole gamut. But you're right, most people don't have symptoms. The majority of them don't. They'll go 20 years without even knowing that they have it, and they're just completely fine. So,
And now what about HIV? Do you know the number of HIV positive people in Missoula County? Is it
I
on the
do.
rise or decrease?
it is actually, it kind of holds its own. You know, we're fortunate in Montana that we don't have a lot of people that are infected. And we just kind of maintained, for the state of Montana, there's 688 documented cases of HIV/AIDS, because there is a difference in the two, and that's since '85. Missoula County, since '85, we've had 81 cases. Now, the odd, and I guess I should say interesting thing about HIV is if they come to me and I test them, I test anonymously, which means I don't have your name, address, phone number. I have no information on you. If you're positive, I advise you, I encourage you to go seek the care of a doctor, but your name and nothing's turned over to nothing's reported to the state,
Right.
because it's anonymous, and I rely on you to do that. And usually I talk to people enough, sometimes they'll run, but give them a few weeks and they'll come back, and they usually do call me. The past 2 years that I've been doing this testing, I've had 7 positives. The demographics of those 7 is that they were all men, and the majority it was cherry needles. So it's here. It is definitely here. But like I said, our numbers are not outrageous. So,
And are there resources for people who do develop AIDS through the health department? I mean,
Yes.
is there health care for those
there's
people?
a wonderful resource. It's called the Ryan White Program. And right now, Kathy Mackey is the contact person for that. And it's wonderful. It's resources for counseling, for medication, for housing. Great resource, really good resource. And I work real close with Kathy. And she gave me some numbers of the people that she's working with. 30 are HIV positive, and she said 18 are AIDS. So, but then again, that doesn't add up to 81, but that's because they may see private doctors, and we don't quite know what stage they're at. So it's a little difficult because of confidentiality.
Sure.
And all.
And as far as other sexually transmitted infections go, I know that there's some more common ones like chlamydia
Yep.
And herpes and genital warts. I know that those numbers can be pretty high because we do live in a college town. We tend to have a young, sexually active population. So do you work with those
I do.
infections as well?
Chlamydia is what keeps me in business. It's and right now I've got over about 300, probably close to 400 cases so far. And what I do is, if you go to your doctor and have a pap smear or just the test for chlamydia and gonorrhea, if you're positive, then the doctor's notified, but the lab also notifies me, because we want to make sure that follow-up is done. I'll contact the person, and if you're under 18, what I do is I try to contact you via your cell phone. I will not talk to your parents about it, because it is confidential. And only when it comes to STIs or STDs, that's one area that we're real strict on, that even if you're 13, I will only talk to you. And even though Mom's on the phone and she says, I have a right to know this, I can only talk to the person. And so what I'll do is I'll talk to you about your treatment and make sure that you waited 7 days before having contact with somebody again. And then I'm going to try to ask you who your partners are, because I need to know if you have talked to them. I like to talk to them so I can educate. But also make sure that they went in to either get tested or treated, because chlamydia, we want to stop it, and the only way to do that is talk to people and talk to their contacts. Same with gonorrhea. Syphilis is back. I've had a syphilis case already this year. I had 3 last year, so it's not gone like we hoped it was.
And with chlamydia, it's a relatively easy treatment. It's a course of antibiotics.
Doses it to
right.
max.
So
it is so easy.
yeah, it's nothing that's painful process to
Right.
cure.
Right.
And can you tell me, do most people have symptoms of chlamydia? Do they know
No,
that
they
they
don't.
have
They
it?
don't.
Okay.
I would say close to half of the people, girls and boys, men and women, don't have any symptoms.
Okay.
So, and that's what makes it hard, because say the girl goes in and she's positive, and she talks to her boyfriend, and he says, "Well, I don't have any symptoms. I can't have it," but that's because he doesn't know. and he very well probably has it. So follow your doctor's advice, and if he says she has it, you need to get treated, take the Zithromax. One dose, it's easy.
Is chlamydia like other sexually transmitted infections like HIV, that you can protect yourself somewhat by using a condom or asking your partner to use a condom, so that does work as a barrier?
Condoms do work for chlamydia and gonorrhea too. Now, syphilis, lesions, some herpes, depending on the area, condoms won't work, and that's just because it's skin to skin.
Right, right. Well, you mentioned bats earlier, and that caught my attention. Can you talk a little bit about bats and what's going on with bats in Missoula County?
One of the communicable diseases that I deal with is rabies exposure, and in Missoula County, that is via the bat. And in Montana, we have the big brown bat and the hoary bat, and they can both transmit the rabies from the literature I found. And we've actually had, we sent a bat in Monday to Prine, and they forwarded on, and it came back rabid. And what was so hard about this one is that the bat actually had bit somebody. So now they're going to have to go on the post-exposure prophylaxis, which is not like it used to be. It used to be several shots in the abdominal area. Now it's 5 shots, starting with an immune globulin in the arm over a month period. It's very expensive. You end up, it's about $1,000 for the whole series. But too, we encourage people. CDC has national recommendations, and if you wake up and there's a bat in the corner of your house or anywhere in your home, and you absolutely can't say without 100% that that bat didn't bite you, you need to be prophylaxed. And a bat can bite you. They have very fine, it's almost like pin-like, and they can bite you without you knowing. So this is, and this month is real bad. The bats are having their babies. A lot of people are seeing the bats, and so they're climbing up on their house and they're closing them in, which is not the thing to do. Bats migrate, and so if you just wait until about August, they're going to go anyway, because what you do is when you close them in from the outside, they go into your house. They can squeeze into a hole like a half an inch. I mean, they're like a mouse.
So you suggest if someone sees a bat, around their house, that just don't close up the attic area.
Leave it alone.
And that's
Just leave it
okay.
alone.
You don't have to call anyone if you know that they're in your attic but not in the house?
Right. You just want to keep them out of your living space is what's most important.
Okay.
But if you see one in your living space and you know that, I mean, you can't say that it didn't get to you somehow, call us and we'll help you go through the steps.
And you mentioned to me before the show that if you see a bat in the daytime just hanging out, that's a sign that
That is a sign, because they're nocturnal and they should not be out. And contact someone. If you can, the best thing, if you can trap it, put it in a coffee can. Don't touch it. And like I said, Prine Veterinary is that's who I refer them to, because they'll send the bats off and have them tested. But be real careful around them. They can bite through gloves. If your cat brings one in, like I said, don't just throw it outside. Try to capture it, because that way, if it's just one bat in your home and you know it's negative, you don't have to go through the whole series.
Right.
So.
Well, is there anything else you want to talk about today? We covered a lot.
We
from
did cover
HIV
a lot.
to bats.
Let's see. I also investigate foodborne illnesses. So if you eat somewhere and you don't feel, or you start feeling bad, nauseated, you give me a call, because I'll talk that over with you. We also have sanitarians that do inspect restaurants throughout Missoula, and you can call them and just talk over things with them, because we want to know. We want to stay on top of, especially the foodborne illnesses.
Sure. And so if someone feels that they got sick at eating in a specific restaurant, I mean, what steps does the health department take? Do you just talk to them about it, or do you just go right away to that restaurant? Is there a certain protocol?
First we'll talk to the person. And if they say, like, we had 10 people there and we're all having the same symptoms, then we're out there. The sanitarians, and sometimes I will go with them, and they'll do an inspection just to see if maybe there's something obvious. But we question about sick employees and all, because we want to keep Missoula healthy, and that's.
Does that happen very often in Missoula?
No, we have a great, all the restaurants here are just wonderful. Rarely do we have people come down with hepatitis A or salmonella, for that matter. We're real good.
And the symptoms of hepatitis A would be obviously
nausea, vomiting, malaise, where you feel just really tired. And usually with Hep A, you end up jaundiced, which the white of your eyes turn yellow, and your skin actually has a nice yellow glow to it. But with hepatitis A, once you've had it, you're over it, you're immune for life. Now, hepatitis A and B are vaccine preventable. So I encourage everybody, especially if you're going to travel outside the country, get your hepatitis A shots. It's a 2-shot series. And hepatitis B, if you haven't had it, you need it anyway. It's a 3-shot series. Because there's no point in getting sick like that, because hepatitis can lead to cancer of the liver, and it's just too many, it's avoidable. And these shots, we start babies with them, and I rarely see side effects. In fact, I've never seen side effects from those, so they're very safe.
Well, so if someone were to get sick and they thought that it was food poisoning, how long does it take from the time that you eat something that is bad to the time that you feel sick?
Well, see,
3
and that's
hours
going to
or-
vary. With Salmonella, it's a little bit longer. Like with E. coli, it can be within a few hours. It all depends on what you're talking about. In fact, the Campylobacter, which is a foodborne, I see that with people coming back from Mexico. That has a different incubation period. Oh, I have to keep a list by my phone because there's so many of them, and the incubation period, it varies from just a few hours to a few days.
And as far as E. coli goes, do you see many cases of E. coli in Missoula?
We haven't had
or-
we had one this year, but it was isolated. It just, we never did figure that one out. It's just
Okay.
one patient, don't know where she got it. But no, it's pretty rare to see that one.
Okay.
I see more Giardia than anything, but that's because we have such beautiful rivers and creeks up here, and it's hard to not drink from it when you're up in the Bob Marshall.
So that's what it is. There's people drinking when they're backpacking or
Right.
hiking. And,
Yeah.
And so to avoid that, isn't there something that you can take
There are
to-
filters, and there's
Right.
iodine, and also boiling
boiling.
works too.
Is there a set amount of time that you need to boil the water to make sure that it's free of Giardia? Or?
You know, I'm not real sure. There is, but as far as coming up with that, I couldn't tell you exactly how many minutes.
You'd probably be safe doing it for 10 minutes. Or
That would be a good rule of thumb. Yeah.
Okay.
Yeah.
Well, thank you, Pam. It's been
Thank
so
you.
interesting talking to you. It sounds like you have a really interesting job.
I love
and
my job.
Sounds like you're busy all the time.
I wear several different hats too.
Yeah, well, you're doing a great job for
Well,
the
thank you.
citizens of Missoula, so thank you so much.
Thanks.
My guest today has been Pam Goldberg. She works with infectious diseases at the Missoula City County Health Department. Thanks so much for watching Working for You.